So I'd like to go to the bariatric tool, what Bob already told us about. Maybe a little bit context-wise, as an obesity team, we're working with a multidisciplinary approach for 20 years now, and we felt the need for a higher level of follow-up that is more patient-centered. Patient needs to be at the central part and need to be able to interact as much as possible. And being able to perform this follow-up for a very long term, because if we need those patients to change their lifestyle habits, we need to follow them for a very long time, and that is not easy. So doing part of this follow-up remotely is an enormous influence for those patients. So if we look at the slide, I will go through the project that is working now at the hospital. First of all, the first part for those patients is the screening. We start off with an intake. We talk to the patients, and as soon as we together decide to go further, we'll first of all need to know more about the patient, and we'll do a screening with lots of questions, obviously consultations with cardiologist, endocrinologist, psychologist, dietitian, etc. But as well a lot of questionnaires, and those questionnaires most of them are validated. It's a lot of work into it, and using the application we can provide those patients very easily with those questions, and answering those questions it's much more easy using this type of application. Once this screening is done, we'll gather all the information and we'll do a multidisciplinary team approach where we give the patient and together with the patient we'll try to have the best possible treatment for the short and the long term. And whenever there is obesity surgery as a part of that treatment, they have to go through the certain next steps that are listed here. First of all, we have the preparation phase. During that phase, they will get again a lot of information. As Bob already told, the information is given at a certain time, because when we start off giving patient information of the whole project and the whole strategy, they lose a lot of information because it's too much on one time. So it's all in small bits. And during the preparation, they will adjust already their eating habits. They will get a lot of information on vitamins, on protein diet, and that's what they'll start with about 2 weeks before surgery. They'll start with a protein diet, and again, we can use the application to make sure the patients do that properly. Then, obviously, we have a perioperative phase. In the hospital itself, patient is already fully informed using the information we give them during the outpatient clinic, but those informative issues are made stronger when you during the follow-up and during these certain steps you again and again give information at the right time. After the operation, a very important part is giving a lot of questions and asking a lot of questions. This means patients get informed but get a lot of possibilities to give themselves answers to simple questions, and most of them are healthcare indicators. Do you feel good? Are you nauseous? Do you have pain, etc.? Answering those questions, for every answer, we, with this application, are provided with a score system. And while patients answer their questions, these scoring systems will give us a lot of information during the consultation when we look at it in a dashboard. I will give you further information later on. But more strongly, whenever those scoring systems are giving us a message, things do not go very well, we have to interact earlier, then we can do so, because the system will provide us with a message automatically, as Bob already told us, and we can use the chat function in the application to go in contact with the patient. Further on, we have this dashboard, as I told you. We can follow up the patients, pick out one patient and look how things go. And obviously, when there is a notice and a flag that we have to check for things, then the possibility is very easy to check this dashboard. As already been told, the escalation phase is, I think, quite unique for us as surgeons. What happens is that during the phase, the patient is at home and is guided, and the follow-up is done through this application. We eventually will have notice of small things that go wrong, and we can very easily interact with the patient to guide them. And in our opinion, this is a true way how a patient himself can interact by asking the team, I need care now, because that's what he needs now, but not because his follow-up outpatient clinic will be within 3 weeks' time. So he can choose, so he or she can choose herself or himself. Gathering data means, of course, that we need to get that data on the right place, and therefore there is a connection necessary between the application and the electronic file of the patient, so that there is already a connection, which is very important. And also for the patient to make sure to show him or her you're doing well, we have to give the patient as well a report with a very simple and colorful drawings to say, well, this is going right, this is going wrong, here we have to adjust, and we have to deal with it. Looking at the impact on the patients, I believe we have an impact on 3 different levels, meaning remote follow-up is a very important one. It becomes manageable for patients to have a very long follow-up because one of the, or part of the follow-up is remote. I'll go back. Okay. Secondly, we have patient and family-centered care. So the patient is in the center, and he or she will have the right information at the right time, chosen by the patient. And 3, we have integrated healthcare. And that's, in our opinion, a true future for healthcare because all possible healthcare providers can join this application. Not only there is the surgeon, not only there is the general practitioner or the dietitian or the psychologist, but we have the cardiologist, we have the whole team on all possible levels of healthcare providers, and that together brings us to integrated healthcare, and that's the future, I think.
Yeah. You say we get in contact with the patient. Do I understand that in Mol there's someone, a nurse, interacting with them?
In the program, we have chosen that whenever there is a message generated by the application, the dietitian will be the first to see it, because most of the interaction at that time will be food related. And then the dietitian will give some explanation. But in case he or she said, well, this is truly medical, we on our side will get a message on our telephone, our iPhone, and just say, oh, just have a look at that patient. So it can go very, very quick. And the time the patient puts in a message, it can take a couple of hours to a couple of days to have already a treatment available, interaction available for the patient, while otherwise it would take 3 weeks or so until the next consultation.
A bold question. What's the workload for you? You have lots of time, I guess. So how much time does it take?
The main issue about that is information. The first thing is to inform. If patients are very well informed, the chances that they have to call you or send you a lot of messages, I don't understand, those things shouldn't happen. So that's a large part. In case it does, it's mainly related to adjustments for foods. So that means the dietitians go through all the files anyway, and we have adjusted, as comes funding is very important, we have adjusted their time. So we make sure that they have enough time to go through all the files proactively and see what's going on, how are things going. So eventually for the surgeon itself, there's a lot of filtering already going on. There's a lot of information already on the website. There's already a lot of information given. So eventually what we need to do as an interaction is not so much.